New tonight at 10, for the first time since the pandemic began, we're taking an inside look at a COVID-19 unit in our area. Thanks for joining us. I'm Catherine Helverson.
And I'm Brad Hanson. News 9's Isaac Dienison takes us inside the unit at Marshfield-Medical-Center, what it looks like now and the struggles they've gone through.
Yeah, with the unpredictable nature of the pandemic, it was not ever guaranteed that we would get access. But while we were there, we were told some patients had spent weeks behind the doors in intensive care. Let's go inside. These doors on the third floor of Marshfield Medical Center in Marshfield don't have many walk through them. But as we got to see firsthand, the patients that enter are often fighting for their lives, battling COVID-19. But of course, it wasn't always this way.
We started to take notice of this at that time when the CDC took notice of it.
In the beginning, as more people got sick, Chief Medical Officer William Melms and staff were forced to change course.
It really hit everybody like a brick wall.
Those changes affecting people like nurse Ryan Lech, having to pivot as departments were quickly overhauled.
We did it overnight.
And supplies were running low.
We counted up our masks and determined, wait a second, if we use our masks at the same rate we're using them now, they will be gone in 10 days, and we don't have another source.
An almost unthinkable thought now in 2021. Health systems like Marshfield have managed to recover since those early stages, but not without bumps in the road.
I have to admit that our care has been decreased because of staffing. Staffing has been a bigger issue now than it was last November.
It has been much more stressful. Yeah, the new norm is managing many more medications, a lot more different departments.
Ryan says the experience of working in a COVID unit during a worldwide pandemic has really opened his eyes.
You can only describe so much unless you're actually a part of it.
And for the first time, we got to see it. Walking through the COVID unit, seeing patients intubated, and a sense of quiet with no visitors in sight. While the COVID unit in Marshfield isn't at peak numbers, still nearly a dozen patients are just on one floor, and some clinging to life. Nurses doing what they can, grateful there are empty beds and rooms without patients.
All of our victories now have become so much more important for us.
The pandemic has been a learning experience for everyone.
Well, I would say things would be different if we had it to do all over again.
But with new variants infecting many more every day, though nearly 2 years have passed, there's still more to be learned, and more people will come through these doors.
The lesson here is that the vaccine works. The vaccine prevents people from being hospitalized. It prevents people from being in the intensive care. It prevents people from being on a ventilator, on ECMO, and it prevents people from dying of COVID-19.
Now, Ryan Lech, the nurse that we featured, says when a patient leaves intensive care, he and the other nurses have a tradition where they send the patient off with a round of applause. Live in studio, Isaac Dienison, News 9 WAOW.